I'm talking to Dr. Boris Petrikovsky, Professor of Obstetrics and Gynecology. He is a Life Fellow of American College of Obstetrics and Gynecology. Good morning, Dr. Petrikovsky.
Good morning, Shlomo.
You recently published an article with the heading of Transatlantic Air Travel in the Third Trimester of Pregnancy. Does it affect the fetus? Is the fetus really safe, Dr. Petrikovsky?
Well, I'm glad you raised this question, Shlomo, because over years we were taking care of a lot of patients, both Americans and foreigners, who came to deliver in the United States. And many of them travel not once, but all of them travel in the third trimester of pregnancy. And there was a question whether travel in the third trimester of pregnancy is safe for the fetus. So we did testing upon arrival to the United States, both in Miami and New York, the two sites when we performed deliveries, and fetuses passed pretty much all the tests. And the results after the babies were delivered here were as good as in those patients in control group that never travel. So based on that, we concluded that for majority of patients, it's absolutely safe to travel. Just keep in mind that 90% of our patients travel either business or first class.
So that was a definite proof that you tested and proved it.
Yeah, we really believe and we highly recommend for the patients who need to travel, especially if they're not in a high-risk category, that it's absolutely safe to travel during pregnancy.
Which pregnant women should not travel?
Well, clearly the risks are pretty much for the ladies who, let's say, can go into labor during travel. And it's well known that some patients deliver on the plane, and they usually hit the headlines. By the way, some airlines give babies certain certificates that they can travel for a long time for free, but that's not a desirable thing if the doctor, especially an obstetrician, is not on the plane. So somebody who is at risk of preterm labor, patient with obesity, asthma, or propensity for blood clots should abstain from air travel.
So after which month you recommend not to travel?
Well, most companies, most airlines will not let people go on board after 36, 37 weeks of pregnancy. So clearly you need to check with airline to make sure they allow you on the plane. And the last thing I want to say that the study that was done before, and some of our patients were flight attendants who were flying frequently during pregnancy, and there were results where the outcome of labor and delivery were as good, if not better, than in general population.
Okay, thank you very much.
Thank you, Shlomo.